Today we will be showing you how to put in an IV catheter. You will need gloves. You will need the IV catheter extension set. You would need alcohol preps, an IV start kit which has your tourniquet in it. You would need your IV needle, saline flush, and a syringe. It doesn't matter if you have the ones that are already refilled. And you will need tape. You will first place your patient in a low flowers position in the bed, using any protective towel or pad underneath the arm just in case for any spills. You will explain to your patient what you are going to do and where you are going to do it.
I'm going to start off by setting sure that you're comfortable, and I'm going to be doing a IV start today, so you'll be feeling a little prick. Let me know if you feel any pain.
Open the short extension tubing package and attach an end cap if not in place. Clean the end cap with the alcohol wipe. Insert syringe with normal saline into extension tubing, filling extension tubing with normal saline and applying slide clamp. Remove the syringe and place extension tubing and syringes back on the package with easy reach.
There's one on the corner.
No, definitely.
That too.
Hours before the feed.
She just lost me. Oh. Do what?
It sounds like you're okay. My friend, she's pregnant. She's like 38 weeks. She delivered early with her last baby, so being 38, she's like, I don't know what to do.
It could be anywhere from you.
Provide emotional support as needed to your patient.
Like, I was always in early labor or whatever. I still was in so it really, but I had a psychological scar tissue.
You had to be induced even though they had stitched you up?
The scar tissue made it hard. I don't get past like what, 4? And then I can't take it anymore. Do we need to go to Jackson? I have Dr.
Yeah,
Lennon.
I just hadn't got over there yet.
Thermal way or
She
shots?
went to me a week before.
Okay.
I just told her I can't take it no more. So, all my
She said,
kids-
yeah, it scared her. I didn't know what it was.
My first girl was born the first of the month, my second girl was second of the month, and my first boy the first of the month.
Flush over a trash can to prevent any spills on the floor.
Yeah, we're gonna go.
With tubing primed, select and palpate an appropriate vein. Place gloves on and apply tourniquet 3 to 4 inches above the vein you want. When tying the tourniquet, please make sure the tourniquet is away from the entry site.
Even perfect today by the time we come around the practice day, it's gonna be.
Yeah.
Do again.
Yeah, I'm sure I paid too much for that. Thank you.
On a real patient, you would instruct them to hold the arm lower than the heart.
Now I'm going to clean the insertion site with an alcohol swab. Undo the tourniquet. And you're going to let it dry on its own.
And it was only that part. It was only the
Everything I need.
skills. It wasn't the pediatric. It was only that. And the Cooper was even asking like what part of the room I sat in.
While site is drying,
Yeah, she was like,
gather material and get them ready.
maybe it wasn't. Like, it was well. I don't know. Yeah, it's like the syringe wouldn't show up. It's just
Put this on.
plunger.
No.
Then whenever it says,
Now I'm going to reapply the tourniquet. With the arm.
like, if it was that, I would have skipped over one answer. I could.
Make sure your tourniquet only stays on the patient for less than 60 seconds.
Wash hands, gloves on.
Plain on.
Using your non-dominant hand, place about 1 to 2 inches below the entry site, holding the skin so the vein doesn't roll. Ask the patient to remain still while performing the procedure.
Okay, I need you to stay still. You might see a little pinch, but it'll be tolerable.
Make sure bevel side of the needle is up and at a 10 to 15 degree angle. Insert the catheter. Insert the catheter when blood return is seen. Make sure to apply continuous pressure to your IV entry site. Release the tourniquet after you have taken out the needle.
Go.
Continue to stabilize the catheter. Continue to stabilize the catheter and flush gently
Oh, flush.
with the rest of your normal saline. Make sure to observe the site for any infiltration and any leaking. Apply tape not above the catheter, but underneath. Avoid placing tape onto the entry site. Apply Tegaderm only onto the entry site. Make sure to label with the date, time, site, and the type and size of the catheter or needle. Make sure to tape any flailing ends of the catheter to avoid a patient from accidentally pulling on it. When done, clean up your area, lower your patient, and ask them if they need anything. Please pull up side rails, and you are done.